discuss the yellow flags, which is another interesting point. What are the yellow flags? So first, let's start with the red flags. What are the red flags? So a red flag means that the person with the low back pain has a severe or sinister disease. And what are the severe diseases that can involve the spine? First of all, you can have a trauma, which leads to a fracture of the vertebral column or fracture of the vertebra. You can have a metastasis or a cancer. So cancer mats. Then there can also be another disease, which is the cancer itself, is multiple myeloma. Multiple myeloma. Additionally, you can have infections such as TB of the spine or tuberculosis of the spine, also known as the Pott's disease. You can have osteomyelitis of the spine. And in young patients, there can be axial spondyloarthropathy, such as ANGSPOND, ankylosing spondylitis. And there are some diseases which by themselves are not that severe, but they can cause severe features such as prolapsed lumbar intervertebral disc. They can impinge or they can compress on the nerve roots, and sometimes they can compress the spinal cord itself. So root compression and cord compression are kind of like the red flags. So let's go to the history, and then we'll talk about the clinical exam. So what are the things in history that suggest a red flag? First of all, the age of onset. If the age is less than 20 years, or if the age is more than 55 years, that is a red flag. Because if the patient is in this age category where the patient is older than 55 years, this might suggest that the patient may have had osteoporosis, and that led to osteoporotic fragility fracture. There can be a cancer metastasis, there can be multiple myeloma. So those are the things that will be common in patients who are older than 55. And in younger patients, I think there can be infection, so osteomyelitis and tuberculosis, and there can also be ankylosing spondylitis. So age is a risk factor, extremes of age. Next, character of the pain. If the pain is chronic, constant, and progressive, so progressively increasing in severity and not relieved by rest. So the pain is constant, it's not relieved by rest, not relieved by rest. That suggests a bad pain. And the diseases where there can be a constant pain is cancer, osteomyelitis, fracture. So those are the things that I have to think about when there is constant pain. Next, location of the pain. If the pain is in thoracic region, then that's a bad sign, because mechanical back pain usually does not occur in the thoracic region, rather it occurs in your lower back. So if there is a thoracic pain, this might suggest underlying pathology like carcinomatous metastasis or a fracture. Next history is the past medical history. So there are some risk factors, and if there are present of those risk factors, then they can indicate a sinister cause. So if there is a history of cancer, such as in case of male, there is a history of prostate cancer, in case of female, there is a history of breast cancer, then this might suggest a metastasis. Next, tuberculosis. If someone has a history of pulmonary tuberculosis, this might indicate the patient has developed tuberculosis of the spine, also known as the Pott's disease. If there is history of immunosuppression, such as HIV/AIDS, and history of steroid use, those increases the risk of infection, such as increase the risk of tuberculosis, increase the risk of osteomyelitis by other organisms, and even it can cause paravertebral abscess. And if the patient has history of osteoporosis, such as a T-score of less than -2.5, then this might indicate that the patient has developed a fracture, which is oftentimes a compression collapse. So this is a compression collapse fracture of the spine, which happens with osteoporosis, and oftentimes the fragility fracture, such as due to a fall from like in the washroom or in the bathroom. So fragility fracture in a patient with osteoporosis. So if the histories of cancer, TB, HIV, steroids, and osteoporosis are present, then this might indicate a bad cause. Next, constitutional illness. If the patient has systemic symptoms, so let's say systemic symptoms such as fever, sweat, weight loss, those are also indicative of bad diseases, such as if the patient has fever, this might indicate a TB or an osteomyelitis or even a cancer. If the patient is sweating, indicates TB or osteomyelitis. If the patient is losing weight, this might indicate an underlying cancer or tuberculosis. And if the patient has history of trauma, major trauma, and following the major trauma, the patient developed a fracture, this can lead to a severe back pain. So if there is history of major trauma, we'll think of a fracture. So those are the points in history. Now let's talk about the points in examination. So the basic idea is if you find a focal spine lesion, such as a spinal deformity, such as a painful spinal deformity, that's indicative of bad diseases. And the painful spinal deformity can occur with TB, cancer, and even in fracture. Then if you have any neurological feature, those are also indicative of bad diseases. So neurologic features may include motor and sensory features. So among the sensory feature, if the patient has a saddle anesthesia, that might indicate the patient has developed a cauda equina syndrome. There can also be motor symptoms. So there can also be weakness. There can be decreased reflexes. And if the signs are present at multiple levels or multiple root level, that might indicate a cauda equina syndrome. So those are the neurologic feature that indicate a bad sign. Those are kind of like red flags. So after the red flags, let's talk about the yellow flags. What are the yellow flags for low back pain? The yellow flags for low back pain are factors that increases the chronicity, increases the chance of chronicity and disability from the low back pain. What are the factors? The factors can be classified into 4 classes. Number 1, psychological factors. So psychological factor. Number 2, if the patient believes that the diagnosis is severe, so a belief. So belief of the diagnosis that is a severe diagnosis, the patient might have cancer. If they believe that the patient has cancer, then that will lead to a chronicity. If the patient believes that there is no chance or very poor chance of improvement, that's a yellow flag. And if there is ongoing litigation or any legal consequences of the low back pain, if the patient is waiting for a compensation, then the patient is not likely to cooperate with the treatment. So if there is a litigation going on, then that will probably lead to a chronicity. Litigation and compensation claims. Okay, so we have discussed the red flags and we have discussed the yellow flags for low back pain. If we summarize the findings, the red flags usually indicate a sinister disease such as fracture, such as cancer or metastasis, such as multiple myeloma, such as tuberculosis and osteomyelitis. So among the history, the features that suggest a red flag: age less than 20 or more than 55 years, constant pain that is not relieved by rest, location of pain in the thoracic region, and past medical history of diseases such as carcinoma, such as tuberculosis, history of HIV/AIDS, intake of steroid, and osteoporosis. Next, systemic symptoms, presence of systemic symptoms such as fever, sweat, and weight loss, history of major trauma. So those are the history points of red flag signs in low back pain. In examination, if there is a painful spinal deformity or if there is neurologic features such as sensory features such as saddle anesthesia, weakness and decrease of reflexes, and multiple root level findings. So those are the red flags. The yellow flags increase the risk of chronicity and disability, and those include the psychological factors such as anxiety, such as depression, or history of other chronic pain disease. If there is a belief that the condition is very severe or there is no chance of improvement by the patient, and if there is ongoing litigation and compensation claims, all of those will increase the risk of chronicity and increase the risk of disability. Okay, that's all.